Hello everyone, welcome to the channel. My name is Sean Hardy. I'm a doctor of physical therapy. Today I'm going to go over my rehab protocol for an ankle sprain. Now this video is for educational purposes only. If you are rehabbing an ankle sprain, please contact a medical professional. Now there may be additional injuries associated with ankle sprains, but for the purpose of this protocol, I'm just going to be going over a general ankle sprain, excluding any types of fractures or major muscle tears or articular cartilage injuries. And ankle sprains can be categorized into 3 grades depending on severity. Grade 1, 2, and 3, ranging from mild, moderate to severe. And this will give you a general idea of the expected recovery time frame. Now grade 1 ankle sprain, this is where you have microscopic tearing or stretching of the ligaments of the ankle. May have minimal swelling or tenderness around the ankle, but the overall structure and function of the ankle remain intact. This way you may see some athletes return back to play the same day or shortly thereafter. But overall, grade 1 ankle sprain generally has a recovery time frame of 3 weeks or less. A grade 2 ankle sprain, this is where you have partial tearing of one or more ligaments of the ankle. May notice moderate swelling or bruising and significant limping. The expected recovery time frame for a grade 2 ankle sprain is about 4 to 12 weeks. And a grade 3 ankle sprain, this is a severe ankle sprain where you have complete tear of one or more ligaments of the ankle. You expect significant swelling, significant bruising, also difficulty with weight bearing. Some physicians may recommend immobilization for 7 to 10 days. And the expected recovery time frame is going to be about 12 weeks or more. Now the first phase of this protocol is going to be pain and inflammation control. And this phase generally takes about 14 days. And it doesn't mean the pain and inflammation is going to be gone by 14 days, but that's how long it takes to get the pain and inflammation under control into tolerable levels. The treatment interventions during this phase are going to be your rest, ice, compression, and elevation. Although there is some research that indicates that frequent icing may not be indicated, because swelling is beneficial because it does bring nutrients and cells to the tissue to help rebuild and repair that tissue. Other treatment interventions are going to be a superficial effleurage or gentle massage around the foot and ankle. This helps with promoting circulation, flushing out inflammation, helps desensitize nerves, and smooth out scar tissue. So generally when you do this, you start sweeping at the midfoot up towards the heart, working your way around the ankle up into the calf. If you do have some swelling that extends into the toes, then you will start at the toes, work your way into the midfoot, around the ankle, and up into the calf. So the second phase is going to focus on ankle range of motion and weight bearing. This can take place within the first 3 weeks, but generally after pain and inflammation are under control. General interventions are going to include ankle circles, where you're moving your foot in clockwise and counterclockwise directions. Ankle pumps, where you're moving your foot back and forth, like you're pressing on a gas pedal. Seated heel raises. Toe scrunches with and without a towel, ankle windshield wipers, weight shifting, and gait training with the emphasis on heel-toe gait pattern. So the third phase focuses on balance training and initiation of gradual strengthening, also continued range of motion. Depending on the severity of the ankle sprain, this can start as early as 1 week or as late as 6 weeks. So the balance training progression is going to start with tandem balance, progressing to single leg balance, then single leg balance with eyes closed, then balance on a foam or unstable surface such as a sofa cushion or a pillow, and then a dynamic running balance exercise. Strength progressions start with resistance ankle inversion and eversion, standing double leg heel raises, then progressing to single leg heel raises off a step, and single leg inversion, eversion with the band. In this stage, core and hip and knee strengthening should be included if not able to do during the early phases. So for the fourth and final phase, it will depend on the person's goals. This phase will focus on power, strength, and agility. And the goal of this phase is basically to achieve at least 90% functional strength when comparing the injured ankle side to the non-injured side. A cluster of tests will be performed to ensure that this criteria is met, such as a single limb hop for distance, vertical jump test, triple crossover test, wide balance excursion test, and various agility tests such as lateral shuffling. Plyometric progressions will include mini jumps in place, progressing to drop lands, then 1 to 2 jumping, 2-to-1 jumping, 1-to-1 jumping, and lateral leaps. Agility will include lateral shuffling, T-drills, ladder drills, and progressing to single leg ladder drills. So that's my rehab protocol for an ankle sprain. Of course, every protocol should be modified and tailored to fit the person in front of you, but this should give you a general overview of the rehab process. If you have any questions or comments, please leave them down in the comment section below. If you like this content, please like and subscribe. And with that, thank you, and I'll see you in the next video.